Thank you, Mark. Thank you, guys, for the music. Very good. So very pleased to be here. Very happy to join the DLD conference for the first time. Actually, I never came to this conference, and I'm very amazed by the different presentation. My presentation will be a bit different from what we had earlier, but it will be related. You will see. Actually, when we discussed with Mark and the team a few months ago, the idea was to discuss about healthcare, and I'm working in healthcare since 15 years now, working on innovation in healthcare and technologies applied to healthcare. And the idea was to make a parallel between the circular economy, the circularity, the concept of circularity we have in this conference today, and the kind of work I can develop in healthcare. And I will talk a lot, as Mark said, about prevention or preventive model. So we talked a lot today about this, take, make, waste. Everybody knows this model. And actually, I have to start, even in my presentation, it's not about this topic, but I'm as well a researcher and researching on this question of the impact of healthcare systems on the environment. We just published actually recently a book on this topic, but actually what not everybody knows, but healthcare systems are accountable for between 4 and 5% of the greenhouse gas emission in the world, which makes a huge impact on the environment. If it was a country, if we take whole healthcare systems in one and it would make a country, it would be the 5th emitter in the world. So it's not something small, or it would be more than 500 coal-fired power plants. So healthcare has huge challenges in managing the emission and managing waste. Here you have a picture. Maria is a Danish patient. She had a breast surgery after a cancer. She's now very fine, but she has been shocked by the quantity of waste that one surgery was generating. You have here the picture. So of course, if you multiply by the number of patients and the number of surgeries we are doing every year in each country, it's a huge amount of waste. So there are many challenges to reduce the impact of healthcare systems on the environment, but I won't talk in detail about that. I will try to make more a metaphoric presentation around healthcare and the transformation of healthcare, which should be circular, in my opinion. So let's take that, make, waste. We have transformed that with the circular economy. Took the colleagues from the foundation I discussed with earlier will be happy. I took this vision, but it's basically the reference for circular economy. But life is circular in itself. If we think about it, everything is circular, or naturally circular. Of course, we have different cycles that we are all relying on. We are relying on the carbon cycle, the nitrogen cycle, the phosphorus or the water cycle. All these cycles are necessary for life, for health, for the well-being of the populations, and it's important to preserve them. So that's why, what I was saying just before, health is at the same time curing people, but as well deteriorating the environment, so it's not exactly what we want. If we zoom a bit to the human body, we have different examples of circular economy within us. We have the metabolism system, which allows to circulate products and material, which it decomposes in simple molecules and then reorganize these molecules and be able via two phenomena, anabolism and catabolism, to be able to reuse a large part of our bodies. We have as well the example of regeneration. The liver is very famous, but the liver is an organ we have that is able to regenerate itself naturally. And we have a kind of waste management with the kidney. Waste management, which is not only eliminating, but as well filtering, reusing, transforming, and re-injecting in the body. So in the end, the human body is depending on natural cycles that we see previously, but as well internal cycles. We call that in medicine homeostasis, and the capacity to manage this equilibrium with different forces and processes that will maintain the balance in our body. So what we did in medicine and in healthcare to cope with the different challenges we had around health, we didn't took the approach of circularity that we had naturally in the environment, naturally in the human body, but we designed the system like this, linear systems. We are most of the time in this kind of pathway when we are a patient, and we are all patients potentially in our life, where we have some actions, usually the government are developing some action on prevention, and then you are diagnosed, then you have, if you have an issue, a treatment, and then you have a follow-up. And actually what we did as well to develop the medicine across the centuries was to specialize a lot the physicians, specialize a lot our hospitals. We build acute care centers, so it means that we wait for people having a problem to develop a service against this problem and find a solution. But we develop the solution piece by piece. So we take the body. If you look at an hospital, you have cardiology, you have endocrinology, you have different geriatry, you have different domains and medicine, and each domain, each physician or group of physicians will look at a fragmented reality of the human body. And most of the time, this leads to an increase of the cost because we are not looking at health most of the time in a holistic manner. We are looking at health in a very specific and narrow or fragmented manner. And actually, it increases the cost, but usually as well we observe that the satisfaction of people with the healthcare system is not so good. The people are treated for a specific problem, but usually the physicians don't have the time. I'm not throwing stones to the physicians. I work every day with physicians. I respect them very much. But the thing is that the system is designed in a manner that they have to treat the problem they are facing, but not looking necessarily to the whole of a person. The problem with this system, which has been built 70 years ago, the modern healthcare system, which are now a bit in difficulty of funding, of investment from different governments. They were developed and designed just after the Second World War in the shape we have them today. But the challenges we had at the global level for health were not exactly the same. The objective was to create units where we are able to cure people when they have an issue. But nowadays, which kind of challenges we are facing in my sector? In my sector, we are the main challenge we are facing is the demographic change. Population are aging. Population aging generates more disease, but as well generate functional decline and require some kind of assistance. But usually the hospital, which is the main building block of our healthcare systems in most of the country, or even the GPs, the general practitioner that you see each time you have an issue, are not equipped to treat the processes of aging. Processes of aging is a sum of multiple processes we have in our body, and they are not always related to a health issue. They could be cognitive decline, or functional decline, or mobility decline. Actually, the treatment is not a pill. The treatment is another type of support, another type of preventive action, another type of intervention. The thing is that we see aging often, too often, in my opinion, as an issue because the population is aging. We say we have less active part of the population, and it's a burden. And we treat healthcare most of the time as a burden. I prefer to see that as an investment. Actually, even for elderly people, they fulfill a certain number of tasks in the society. They have different roles in the society, or they should at least. And here in Occident, in Europe or in US, we are seeing the aging population as a burden, but in other culture, we are seeing them as a very important asset of the population. So the fact that we invest in preserving the health as much as possible and the well-being of this population is certainly something that we didn't analyze in a sufficient holistic or circular manner to see what the benefit aging population are bringing to the society. Another big challenge we have at the moment is that we have disease that we cannot cure, or we have a limited capacity to cure them. We are calling them the non-communicable disease or the chronic disease, By definition, a chronic disease is chronic, so it means that you will have this disease or live with this disease during many years, maybe for the rest of your life in some case. And it's at the moment around 80% of the spending we are having in healthcare. Again, when you have a cardiovascular disease, you will go to a cardiologist. When you have diabetes, you will go to an endocrinologist. But actually, of course, we have treatments, pills, and pharmaceutical treatments. But we know as well that this type of disease is not related only to pills and treatments. If we look at diabetes, for instance, the risk factors or what will generate a diabetes, by the way, most of the people in this room will have a diabetes after a certain age because we have different habits, lifestyle habits, that favor the development of this kind of disease. So we see that the hospital, as an acute care center, as a center where we are treating a huge problem, is not the solution. The solution is certainly having prevention programs, helping people to improve their diet, improve their physical activity or their movement or the capacity they have to relate to other people, because the different factors like sleep, smoking, or even social relationship are very important in most of chronic disease. The same for aging, actually. So it's important to treat all these aspects if we want, in the first place, to treat this disease. Actually, at the moment in France, I'm French, by the way, living in Barcelona, but I'm French, and the French National Social Security has developed a new plan for diabetes, built not on pharmaceutical treatment, but built on physical activity and diet interventions. So we are in a different way. But the physicians, which are endocrinologists for diabetes, are not the one necessarily that will have the skills and the resources to develop this kind of prevention program. So we will have to work with other type of stakeholders. We talked a lot today about ecosystems, so we come to that, but it's basically what my point. If we look at health globally, what are the factors influencing our health? There is around 10%, usually we say that, 10% the capacity to access to good quality care, which is not the which is mostly the case in Germany, of course, and in Europe, but not the case in every part of the world. 20% is coming from the genetics. So the genetics, we cannot modify that, and it's until now, and hopefully for long, in humans, we cannot act on that. And then we have the major part, 70%, which is related to how we behave and where we live. I have a good friend in the Boston Public Health School who is saying that the health of somebody is more conditioned to his zip code rather than the genes, because it's more important where you live than how you're built internally. If we look as well to these different diseases we have interdependencies. We talked a lot about system thinking or ecosystem thinking. I've been trained in this mindset as well, system thinking. If we look really what is happening to the health, we see connection interdependencies between different diseases, different conditions. For instance, we have seen exploding the mental health crisis after COVID for different reasons. The reasons were not medical, the reasons were social and community-based. The lack of contact, the lack of relationship within our community. Many aspects as well could influence the mental health, of course, but we see that we have interdependency, though. So it's not one single infectious disease physician that will solve the problem that are generated by this disease. If we look in the end at what is making health and the wellness or well-being, wellness is more the US term. In Europe, we prefer well-being. But we have plenty of activities which are not at all related to hospital. Which hospital is talking about spiritual life or purpose in life? Which hospital is talking about intellectual activity? Which hospital is engaging in social relationship and things that will bring you culture or education that will enhance your well-being? So no hospital will do that. After that, we can be cure in the best hospital in the world, and I'm sure in Munich here you have very good hospital and very good physicians, but we are all influenced by where we are living. I was saying that just before, and we have what we call the determinants of health. The kind of education I've received will condition the health I will have in my life. And it's proven by thousands of publications. Lower education level population have more problem of healthcare. So I talk about the healthcare quality, the neighborhood where you live, the built environment. Imagine you are in a city. I was talking with a taxi driver this morning about Munich and the capacity to work within the city, within the city and to have physical activity in the middle of the city and green environment. It's not the case in all cities. So we have different aspects that the physician or the healthcare system won't control. So that means that we have to work with other players. The climate change, of course, impacts health. I will pass this. And we have developed, actually, with the WHO a few years ago, this concept of One Health, because we cannot have healthy humans if we don't have healthy animals and healthy environment and ecosystems. So it's time for change. And actually, the model that we are developing at the moment in Europe and in US and in other countries is the 4P model, personalized, preventive, predictive, participatory healthcare. I won't detail that, it's a bit technical, but just to give you an example, the fact that we are able to create ecosystems of stakeholders and, in this case, data, will help to develop personalized treatment. The work we have with some pharma companies to develop the personal pill. That means that you won't go to the pharmacy to have a box of the pill X, you will go to the pharmacy to have your own pill. Or even in some experimentation, you will 3D print your pill at home, depending on your genome sequencing and depending on your specific situation. We can improve with AI many things in the capacity to analyze data. Here it's an example on the different phase of medical imaging, which is at the center of many, many healthcare processes. We have nowadays a very, very interesting improvement of the efficiency and the efficacy of healthcare system thanks to the new technology. The problem is that we are improving existing processing in an existing model. So we have to think a bit out of the box, and we realize now that most of the scanner we are doing, we can detect things that was not the purpose of the medical exam, but was interesting for the individual to predict diabetes, to predict a cardiovascular disease, or to predict other type of disease. So it's important to have different technology which will be able to support the people in different ways, in different dimensions. AI will help, or is helping us to understand better the context and to go beyond the pure healthcare data that we have. Because in the end, we observe return on investment. Many governments and ministers of health with who I've discussed across the last years were doubting or skeptical about the return on investment of prevention. This is a publication of the NHS. We show here that some preventive actions have some ROI, very interesting ROI actually. I think that some VC will be interested by this ratio because actually it's working. And we see that the color code is that the pink one is the healthcare system doing the preventive action. The other one are done by other type of stakeholder, local authority, associations, and other type of stakeholders. So it means that we have to move beyond the classic healthcare system, and that means as well that we need to use more data as a raw material that we are able to reuse, to distribute across an ecosystem which is not only a healthcare player, and that the circularity I was talking about. We built as well a model of data cooperative in healthcare where different players, a local authority, a physician, a company for its employees, can have access to data, anonymized data, because we are talking about very personal data, to be able to develop strategy. It's reusable, it's creating emergence, it's distorting the space and the time with telemedicine and teleconsultation, and it allows the personalization instead of the one-size-fits-all, which is another characteristic of our healthcare system, and it's scalable, it's digital. So the model is a multi-stakeholder ecosystem. We have different players around health that should be there. It's a circular model as well, as you can see, and we need many data to achieve a better health of our population. So this is a circular health model that I achieved after several years, working with some local authorities, with some healthcare systems, European Commission, and to be able to work both at the individual level and the collective level. And those two aspects, the individual level and the collective level, make a better well-being for the society as a whole, because we see logic of individuals influencing their surroundings, their social relation that improve the community health and be able to provide to the policymaker better information to take better decisions. So that's the circularity of health that we are working on at the moment. Many projects at the moment in Europe are developing on this model. And that's the parallel and the metaphor I wanted to say to you today. Thank you very much for your attention.